Well, as an International AIDS Conference 2016 comes to an end, let us remember that the key agenda for this year's conference is working towards strategies to end the AIDS epidemic by 2030. This may sound like an optimistic statement, but it should be possible if we all commit to this vision. We're crossing once again to our reporter. He's been waking up very early in the morning to keep us updated as to what transpires at the conference for the past 5 days, and it's finally coming to an end. Good morning to you again, Blain.
Yeah, very good morning to you. It is indeed a busy couple of days here, right here in Durban, and civil society has been very, very busy here at the 21st International AIDS Conference. Civil society from across the globe have been working hard in order to put pressure on world leaders to take bold and, I guess, decisive steps in order to end AIDS by 2030. Now, the Treatment Action Campaign has been a leading civil society organization force right here in South Africa. Anele Yawa is the National General Secretary, and he joins me now live to discuss the role of civil society right here in the fight against HIV and AIDS. Anele, thank you very much indeed for your time. Look, the last time the global HIV community gathered back in 2000 right here in Durban, since then South Africa has a very different story to tell, isn't it?
Yes. The challenges we have now are totally different from the challenges we had in 2000. In 2000, there was no access to treatment. There was a lot of denialism. There was a lot of stigmatization and discrimination against people living with HIV and AIDS. And now we are able to say, 16 years down the line, we've got about 3.5 million people who are on ARVs in South Africa. And if it was not because of civil society, we could have been counting the number of people who died of HIV.
Yeah, but we have new challenges.
Yes, new challenges. It can't be true that we talk about an end to AIDS by 2030 because...
You don't believe that's possible?
That is a rhetoric. That's why when we came here, we were clear that we are going to challenge anyone who speaks or talks about an end to AIDS by 2030.
Why don't you believe that's possible?
One, it is because our public healthcare systems globally are still broken. We don't have enough nurses. We don't have enough doctors. Community healthcare workers' working conditions are not right, but also the majority of people who are living with HIV and AIDS, tuberculosis, and other chronic illnesses, they get being turned away from health facilities. When they get there, they are often told that there are no medicines and issues of drug stockouts. But on top of that, every week in South Africa, there are about 2,000 new infections. And the most vulnerable group is the young girls at the age of 15 to 26 years. People who are on ARVs, they are defaulting on treatment, not because of their own making. It is because of the public healthcare system is failing them.
So are you saying what, greater awareness needs to be out there?
No, there is no need for greater awareness. What we need to do as civil society, we need to hold our governments accountable. We need to fix the broken public healthcare system so that the system can be able to deliver the services to the people.
What would it take, as you say, to fix it?
What it takes to fix it? We can have good policies. We are not worried about good policies. What worries us is the implementation. It is a lack of a political leadership and a political will. But on top of that, we need to put more resources to the public healthcare system. We need to put more resources to civil society so that it can continue to do its advocacy work. Civil society is not an extension of government. Civil society is the mouthpiece. It is the the mouthpiece and the representatives of the majority of the poor people on the ground.
Anele Yawa is the National General Secretary from the Treatment Action Campaign, the voice of civil society right here being heard at the 21st International AIDS Conference right here in the port city of Durban as we wrap up. For now, let's take it back to Johannesburg and check in with your sport.